What if I told you that the reason you've been feeling slower, duller, or less confident lately might be traced back to something as simple and overlooked as acidity in your body? And that a teaspoon of baking soda, yes, the same one sitting quietly in your kitchen cabinet, could be the missing key to restoring your energy, your circulation, and even your bedroom confidence after 60. This isn't a theory. This is the science that many older adults have never been told. My name is Dr. William Lee. I'm a physician and research scientist with over 3 decades of experience studying how nutrition and the body's internal chemistry interact at the cellular level. I've dedicated my career to understanding what truly drives vitality, energy, and vascular health in aging adults, without gimmicks, without shortcuts, and without shame. I've seen what genuinely works, and it often begins with the simplest changes. Here's the surprising truth. Baking soda isn't just a household staple. Used correctly, it can help support your blood flow, boost oxygen delivery, improve muscle function, and even open the small vessels that feed your most vital organs, including the ones responsible for sexual performance. Most people have no idea this connection even exists. In this video, you'll learn exactly how to use baking soda safely to support your energy, your physical glow, and your intimate health starting today. No noise, just real solutions grounded in biology that empower you from the inside out. And if you stay with me to the end, I'll give you a simple 7-day protocol that my patients are calling a second chance in a teaspoon. Before we dive in, if you haven't subscribed yet, now is the perfect time. Hit that button and turn on the bell so you never miss another evidence-based, practical tip to help you stay vibrant after 60. And if this message speaks to you, type 1 in the comments. If it doesn't, type 0. Your feedback helps me serve this community better. Let's start with the truth most people never talk about. Why so many older adults begin to lose their natural glow, their energy, and their confidence after 60. It's not simply aging, it's what's happening inside your body that matters most. And understanding this is the first step to getting it all back. 1. Why older bodies lose their glow after 60. I've sat across from hundreds of older men who quietly ask me the same question. Why do I feel like I've lost my spark? It's not vanity. It is a deep human need to feel alive again, to look in the mirror and see vitality, not fatigue, to feel like the man you know yourself to be. After 60, many men notice that their skin looks duller, their energy drops faster, and the confidence they once had in their body quietly fades. Most chalk it up to age. But the real culprit is often something far more specific and far more addressable. Your body's internal environment is shifting. It is becoming more acidic, more inflamed, and increasingly burdened with metabolic waste it can no longer eliminate as efficiently as it once did. As kidney filtration slows and circulation weakens, toxins linger, blood thickens. Little by little, that inner radiance dims, not because you've aged past the point of no return, but because your internal chemistry has drifted out of balance. I think of a patient, I'll call him Harold, 67 years old, who told me he used to feel electric in the mornings. Sharp, strong, ready, but lately, even after 8 hours of sleep, he still felt sluggish. His skin looked tired. His drive had gone quiet. His previous doctors told him everything was within normal range, but Harold knew something fundamental had changed. The truth, as I've learned from decades of research, is that our bodies were not designed to run indefinitely under the slow accumulation of metabolic acidity. They need help restoring balance. And sometimes that help comes from the most unexpected places. Which brings us to something simple, overlooked, and surprisingly well supported by science. baking soda. Because once you understand how it restores your body's natural chemistry, you will never look at it the same way again. 2. The science of baking soda and your body's pH. When I first explain to patients how baking soda works inside the body, their reaction is almost always the same. Wait, that white powder in my kitchen? Yes, exactly that. Beneath all the everyday uses most people know, baking soda is a natural alkalizing agent. That means it helps neutralize excess acid in the body, gently shifting your internal chemistry back toward a more balanced state. And for someone over 60, that balance can make a measurable difference in how you feel, how you move, and how your body performs. As we age, the body tends to drift toward a more acidic internal environment. This metabolic shift is not always dramatic, but it is consistent and cumulative. Hidden acidity quietly erodes your energy, stiffens your joints, dulls the skin, and slows cellular function across the board. Think of it as a low-grade chemical friction that the body was never designed to sustain long-term. When baking soda is used correctly, it acts as a biochemical buffer, gently clearing that friction away. Blood viscosity decreases slightly, oxygen is transported more efficiently, and inflammation, the underlying driver of so many age-related complaints, begins to ease. I had a patient, I'll call him Raymond, who started a simple, measured baking soda routine and told me afterward, "It's like I got a piece of my spark back." Now, I want to be precise here. Baking soda is not a cure. It is not a silver bullet, but it is a legitimate physiological tool when used with care, proper dosing, and an understanding of what it does and does not do. And it lays the groundwork for something even more foundational to male health, circulation, because without strong, steady blood flow, even the best habits fall short. Let's look at how this humble ingredient may hold the key to restoring one of your body's most essential systems. 3. Baking soda and blood flow. The circulation link. If there is one principle I return to again and again in my research and clinical work, it is this: circulation is everything. Not just in a cardiac sense, in every sense. Blood flow is how oxygen reaches your muscles. It is how nutrients feed your brain. It is how hormones travel to the tissues that need them. And it is the single most important physical mechanism behind sexual function in men. After 60, many men begin to feel colder in their hands and feet, notice slower wound healing, experience more fatigue, and face challenges in the bedroom. These are not isolated complaints. They are a coordinated signal from a body whose circulatory capacity is being quietly reduced. And too often, that signal is dismissed as normal aging rather than addressed as a correctable physiological problem. Here is where baking soda becomes more than a kitchen ingredient. It becomes a circulatory ally with a clear scientific rationale. Research has shown that appropriate doses of sodium bicarbonate can help relax blood vessel walls and support nitric oxide bioavailability, the same molecule that signals arteries to dilate and allow greater blood volume through. In essence, baking soda helps restore the flexibility of the vascular system. It acts as a gentle internal environment modifier, supporting the pathways your blood needs to nourish muscles, brain, skin, and the vascular structures responsible for male sexual performance. I had a patient, call him George, 71, who came to me frustrated by chronically cold limbs and persistent low energy. Within a week of adding a disciplined baking soda protocol to his routine, he told me, "It's like someone turned the faucet back on." That is not magic. That is chemistry operating the way it is supposed to when given the right conditions. Strong blood flow is not just about feeling warmer or more alert. It plays a direct role in performance, stamina, and confidence, especially in the most private areas of a man's life, and that is exactly what we explore next. 4. Baking soda A&D muscle performance after 60. There is a quiet frustration that sets in when your body stops responding the way it once did. I hear it regularly from men who are doing everything they believe is right, eating reasonably, staying somewhat active, and yet still feeling exhausted after minimal effort. What they are describing is not a character failure. It is a biochemical one. As we age, the metabolic byproducts of physical exertion, particularly lactic acid, accumulate in muscle tissue more aggressively and clear more slowly. The result is soreness, stiffness, fatigue, and a recovery window that stretches from hours into days. For many men, this is the point where they begin to move less, which compounds the problem further. Baking soda has a well-documented ability to buffer lactic acid. This is not a new finding. It has been studied in athletic performance contexts for decades. When lactic acid is neutralized more efficiently, muscles work cleaner and recover faster. The practical result is that men feel capable of doing more, and they do not pay as heavy a physical price afterward. I think of a patient, a retired firefighter in his late 60s who still walked every morning. Halfway through his route, leg cramps would force him to stop. We incorporated a small, measured dose of baking soda into his morning routine. A few days later, he completed his full route without cramping for the first time in months. It was a small thing, he told me, but it made me feel like myself again. That is the clinical reality of what lactic acid buffering does for aging men. It does not rebuild muscle from scratch. It removes the chemical barrier that was preventing the muscle you still have from performing as well as it can. And while better physical recovery matters enormously, there is something even more significant that baking soda can support. Something men over 60 think about privately far more than they discuss openly. Let's address it directly. 5. Baking soda A&D mental clarity, the brain-flow connection. There is a particular kind of cognitive frustration that I hear described often in men over 60. You walk into a room and cannot remember why. A word sits just out of reach. You wake up and the mind feels slow, even after adequate sleep. These experiences are often dismissed as minor inconveniences, just part of getting older, but the men I speak with tell me they feel the weight of them. They chip away at confidence in ways that are hard to articulate, but impossible to ignore. I think of a patient, a retired school principal, who told me, "I used to feel sharp, decisive, like I could assess a situation and move. Now I feel like I'm thinking through water." What he was describing was not inevitable cognitive decline. It was, in significant part, a circulation problem. The brain is the most metabolically demanding organ in the body. It consumes roughly 20% of your total oxygen supply, despite representing only about 2% of your body weight. When blood becomes sluggish, when internal pH drifts toward acidity, when vascular flexibility decreases, the brain is among the first organs to register the deficit. Mental fog, slower processing, word retrieval difficulties, and fatigue upon waking are often downstream consequences of impaired cerebral blood flow. This is where baking soda's role as an alkalizing and circulation supporting agent connects directly to cognitive function. By supporting a more balanced internal pH and improving the conditions under which blood travels through vessels, baking soda helps oxygen and nutrients reach the brain more efficiently. The result, described by many of my patients, is a subtle but meaningful lifting of that fog, a return of presence, a sense of being mentally here again. That kind of clarity is not just about memory. It is about showing up fully for your life, your relationships, and your sense of self. And when the mind begins to feel awake again, the rest of the body tends to follow. 6. How baking soda supports intimate vascular health. This is the section where men lean in. And I understand why. Sexual confidence does not simply fade with age. For many men, it gets buried under layers of frustration, silence, and a quiet shame they have carried for years, because no one gave them a clinical explanation for what was happening or a credible path to address it. I want to be direct with you, as a physician who has had these conversations thousands of times. The most common underlying cause of declining sexual performance in men over 60 is not testosterone deficiency. It is impaired blood flow. The small vessels that deliver blood to the erectile tissue have become narrowed, inflamed, or functionally compromised over time. That is a vascular problem. And vascular problems respond to vascular solutions. Here is where baking soda earns its place in that conversation. By reducing systemic acidity and easing inflammation in blood vessel walls, baking soda helps create the internal conditions under which blood can move more freely, not just to the brain and the muscles, but to the vascular structures most central to male sexual function. I have had patients describe this transformation with a directness that stays with me. One man, 72 years old, told me, "It didn't just improve my performance. It gave me back something I hadn't realized I'd lost, my sense of dignity in my own body." That is not a small thing. That is one of the most important things a man can feel. I want to be precise here, because precision matters. Baking soda is not a pharmaceutical. It is not a replacement for a conversation with your physician about erectile health, but it is a legitimate, evidence-informed tool that supports the internal conditions your vascular system needs to function at its best. It is part of a larger strategy, one that works with your biology rather than around it. And now that we understand what baking soda can accomplish inside the body, let me show you exactly how to use it safely, responsibly, and with the full benefit it deserves. 7. How to use baking soda safely, internal A&D external methods. Understanding the mechanism of baking soda is one thing. Using it correctly is another entirely. And this distinction matters because, like any physiologically active substance, baking soda can either help or cause problems depending on how it is handled. I have seen both outcomes in my patients, which is why I want to give you the same guidance I give in a clinical setting. The most effective and well-tolerated internal approach is straightforward. Half a teaspoon of baking soda dissolved in a full glass of room temperature water taken on an empty stomach. Not every day, 3 to 4 times per week is sufficient for most men over 60 to begin shifting internal pH without placing excessive demand on the kidneys or digestive system. Men who follow this protocol consistently report improvements in digestion within the first week. Many notice their skin looks clearer and more hydrated. Some describe feeling physically lighter, a reduction in the subtle bloating and sluggishness that accumulates over time. The changes are not dramatic announcements. They are quiet shifts that build into something meaningful. For those dealing with joint stiffness, peripheral swelling, or skin that has lost its tone and brightness, external applications offer additional benefit. A warm baking soda foot soak before bed can ease tension, support peripheral circulation, and assist the body's natural detoxification through the skin. Some of my patients have incorporated diluted baking soda rinses as a simple skincare step and reported visible improvement in their complexion after just a few uses. But external methods are complementary, not primary. The foundational work happens internally through consistent and measured oral use that supports your vascular chemistry from the inside out. And before you begin, there are critical mistakes I need you to understand and avoid, because these are the errors that cause men to abandon something genuinely helpful before it has the chance to work. 8. The mistakes to avoid with baking soda. The most common reason men fail to get results from baking soda or end up feeling worse is not because the approach doesn't work. It is because they use it without discipline or without understanding the boundaries within which it performs safely. I have seen this pattern repeat itself enough times that I want to address it directly and without ambiguity. The first and most significant mistake is overuse. More is not better here. The physiological principle at work is buffering, not flooding. Taking large amounts or using baking soda multiple times daily can raise sodium levels inappropriately, create digestive discomfort, and in men with existing kidney or cardiovascular conditions, create real complications. I had a patient, call him Robert, who, motivated by enthusiasm, began taking baking soda every morning and every evening. Within 2 weeks, he was experiencing bloating, elevated blood pressure readings, and fatigue. We reduced his frequency, and within days, he was back on track and feeling measurable improvement. The second mistake is treating this as a permanent daily supplement rather than a periodic support tool. Your body does not need constant pH correction. It needs periodic, strategic support. 3 to 4 times per week, taken consistently over weeks and months, is a far more effective and safer approach than aggressive daily dosing. The third mistake, and I cannot state this strongly enough, is failing to consult your physician if you are currently on medication. If you take blood pressure medication, diuretics, or anything that affects kidney function or electrolyte balance, you must discuss this before starting. Natural does not mean risk-free. It means that the risks are manageable when you are informed and working with a clinician who knows your full picture. Done with care and discipline, baking soda becomes a quiet, consistent ally. Done recklessly, it becomes a source of setbacks that discourage you from a genuinely useful protocol. Now, for those who are ready to implement this correctly, I have built a structured approach that my patients find sustainable, effective, and simple enough to maintain without disrupting daily life. 9. The 7-Day Glow A&D Confidence Morning Protocol. The most powerful health transformations I have witnessed in my career did not come from radical overhauls. They came from small, consistent, well-timed interventions that the body could actually sustain. That is the philosophy behind this 7-day protocol. Not a strict regimen to be followed with anxiety, but a structured rhythm that gives your body what it needs without overwhelming it. Here is how it works. On days 1, 3, and 5, alternate support days, take half a teaspoon of baking soda dissolved in a full glass of room temperature water on an empty stomach, at least 30 minutes before breakfast. This is your primary alkalizing and circulatory support window. The body is in a slightly more receptive state before food, and the compound has time to act on the vascular system before digestive processes begin. On days 2, 4, and 6, recovery and reinforcement days, focus on circulation supporting movement. Even a 20 to 30 minute walk is sufficient. Pair this with a baking soda foot soak in the evening if you experience peripheral stiffness or swelling. 2 tablespoons dissolved in warm water for 15 to 20 minutes supports both relaxation and skin level detoxification. On day 7, rest. Let your body integrate what the week has provided. Hydrate well. Sleep without alarm if possible. Your vascular system does its most significant repair work during uninterrupted sleep. And this rest day is not a gap in the protocol. It is a deliberate part of it. I have had patients who followed this for 3 weeks and described the experience with a directness I value. One man, 69 years old, told me, for the first time in years, I looked forward to my mornings. I had something to do for myself that felt like it mattered, and the results came quietly, but they came. That is the kind of shift this protocol is designed to create. Not dramatic announcements, steady, reliable improvement in how you feel, how you move, and how you show up. 10. Final words from Dr. William L.I. There is something I want every man over 60 to hear, not as a platitude, but as a clinical conclusion drawn from decades of evidence and direct patient experience. Your body is not broken. It may be slower in some areas. It may respond differently than it did at 40. It may require more strategic support than it once did, but it is not beyond repair, not beyond restoration, and not beyond the capacity for genuine vitality. I have seen too many men reclaim their energy, their vascular health, and their confidence to accept the alternative conclusion. What I have also observed, and this troubles me more than any medical finding, is how much damage is done by silence. Men who carry years of frustration about fading performance, diminishing energy, and a quiet sense of disappearing from their own lives, without ever being given a real, science-based explanation for what is happening or a credible path forward. That silence is a clinical failure on the part of a medical culture that too often defaults to this is just aging when the evidence says otherwise. You are not experiencing inevitable decline. You are experiencing the accumulated consequence of an internal environment that is drifted out of balance. And internal environments can be shifted. Chemistry can be changed. That is not optimism. That is biochemistry. The approach I've laid out today, using baking soda with precision, consistency, and respect for your body's limits, is one tool in a broader framework of vascular health, nutritional intelligence, and intentional daily choices. It will not do everything, but it will do something. And something, done consistently over time, becomes transformation. When you choose to take your health seriously, when you wake up and make a deliberate, informed decision to support your own biology, you are sending your body a message that it receives at the cellular level. You are telling it that it matters, that you are not finished, that this chapter of your life still deserves your full participation. I believe that with everything my career has taught me, you are not done. You may, in fact, be entering the most knowledgeable, most intentional, most capable period of your life if you give your body the conditions it needs to meet you there. If this message gave you something useful, a new understanding, a reason to act, or simply a sense that someone is speaking to you with honesty and respect, I encourage you to share it with someone who needs it. Leave a comment below telling me what part resonated most or what topic you'd like me to address next. Your engagement shapes what I create, and this community grows stronger every time one man decides to stop accepting less than his body is capable of giving. Thank you for being here. The decision to show up for your own health is never small, and I look forward to continuing this conversation with you.